Well, thank you, and I'm glad to see you all here on a Saturday afternoon. And part of the reason why our organization feels that privacy is so critical is because it's not about privacy. I hear a lot of people say, well, there's nothing really that private in my medical records. First of all, my response to that is, how do you know? Have you read them? You might be surprised what somebody has written in your medical records. I have patients who call me, and they're very surprised, and they don't want the next doctor to see what the other doctor has written in there. But the real thing is that privacy is not about privacy. Privacy is about control. And the Obama administration knows this, the Medicrats know this, that if they have the data, they can make the rules. And that's one of the things that we say, he who holds the data makes the rules. And we want you to hold the data. We want you to have consent over who has your information and where it goes. Well, I've been asked to talk particularly today about the baby DNA issue, which is, I consider, one of the most hidden issues in this country, but it's happening in every state. Everywhere from California to Maine, state governments are collecting, storing, using, and sharing newborn DNA for the purposes of genetic research, all without the knowledge or consent of parents. Parents are absolutely clueless that this is going on. When I'm done, and if you want more information, there's a little card that is on the white table out there, Protect Your Baby, Reclaim Their DNA, and we have a website, itsmydna.org. And you can find videos and lots of other information on that website. So this whole thing is happening without parents' consent. And typically it happens in the hospital within 24 to 48 hours of the child's birth. And the hospital personnel comes in and they prick the heel of the baby and they put it on a special card which has special filter paper on. And then it's sent directly to the government. The hospital has nothing to do with this. The hospital is simply the collecting arm of the government for the child's DNA. Then, and this is all part of the state-mandated program called newborn screening, or as I prefer to call it, newborn genetic testing, because that's really what's taking place. Newborn screening has been called the largest application of genetic testing in the United States, but most parents don't even know that it's happening. Yet, if a hospital wanted to test you or I for our genetics, they would have to have our written informed consent. But not so with newborn genetic testing. This just happens. It began in 1960 with the mandated requirement of PKU testing, and some of you may remember the PKU test. Well, now it's much more than a PKU test because most states are testing for at least 29 newborn conditions. And some states like Minnesota are testing for more than 50. California, I think, is even up to 80, but part of it is with your consent and part of it is without. So, as I said, parents are clueless, and as a report from the Secretary of Health and Human Services Advisory Committee on Heritable Disorders in Newborns and Children recently pointed out, much of the public has little understanding or awareness of the newborn screening program, and they know this. And because parents don't know anything about the screening, they don't know that their baby is having a genetic test, and they don't know that their baby's DNA is being sent to the government, and they don't know that their baby's DNA is considered a national treasure. It's also called state government property. So parents do not know that their baby's DNA is being stored, used, and shared for genetic research. And children who are turning 18 and becoming adults do not know that their DNA is stored and owned by the government. Yet there are warehouses of baby DNA in 18 states that keep it for 10 years to indefinitely. Washington State has more than 40 years of baby DNA in their storehouse. Proponents of state ownership of newborn DNA are afraid that if they inform parents about what is going on, that if they give parents the right to what happens with the DNA, then the parents are going to start to refuse the genetic testing. But that's not what we've found. What we find with parents who are unhappy about this, what we find is that they want the screening because they want to protect their newborn. They just don't want the government to do it. They would like the hospital to do it. They would like some private entity to do it, but they don't want the government to do it. So this points out several problems with the newborn genetic testing program. Number one, it's a government program, so the genetic test results become part of a government record on the individual starting at birth. And this is really important to understand because in the future, not that far in the future, the proponents of newborn screening want to do a complete genomic sequence of every child at birth, which would mean that everyone's DNA would be registered, the entire code at birth for whatever the government wanted to do with it after that purpose. Number two, there are very few private options because the government has a virtual monopoly on the testing program. Number three, the government testing gives government access to the blood, which is the DNA. In other words, if they didn't do the test, they'd never get the DNA. And then number four, because there's no consent for the testing, there's little incentive to tell the parents what's going on. You don't have to because you're required to do it, so why tell them anything, right? The Secretary's Committee just issued recommendations on the retention and use of newborn DNA. They recommend that states be the stewards, this is what they call it, the stewards of the DNA. So from the time the child is born, the state will be the steward over the DNA. They'll keep it. They'll be the stewards, right? They recommend that parents get more information, but that states only consider whether or not parents get any consent over the process. So they don't actually recommend consent. And they recommend that states not be required to destroy the DNA warehouses that have been created. So, for example, they disapprove of the decision by the Texas judge that forced the Texas Department of Health to destroy more than 5 million cards holding the DNA of infants. Recent studies on the issue, brought about because of our efforts to inform the public and advance consent requirements nationwide, show considerable public concern by parents once they're informed, and even by those who are working in the programs. One study using focus groups made up of members of state newborn screening advisory committees found participants questioning whether the primary purpose of blood collection was to screen babies or to accumulate research samples. Another study using focus groups of parents and other members of the public brought out comments like, "This must be illegal." And another study discovered that parents want the blood samples to be called what we have always called them and what they truly are, DNA. The parents said, "This is the DNA, you should be calling it the DNA rather than residual dried blood spots," which is what the government calls it. So as the administration advances racial and ethnic profiling to reduce health disparities in your doctor's office, and I hope you don't fill out those forms, and as they advance the creation of a national health data system, the National Health Information Network, essentially a network of networks of state health information systems, in which 2.2 million entities will have ready access to our private medical records, this use of genetic privacy, or this issue of genetic privacy, DNA ownership, and parent and patient consent becomes even more important. States can pass legislation opting out, and it's important that the Tennessee legislators who are here, that they would do this, because HIPAA actually allows them to have stronger privacy laws than HIPAA, and they have to be enforced. In June, the National Human Genome Research Institute announced funding opportunities for researchers with expertise in conducting genomic research using pediatric biorepositories and electronic medical records. That would be the DNA warehouses. And the whole plan here is to genotype every child from birth, to put the genetic code into the permanent medical record, and to use it, as they say, for genetic risk assessment, prevention, diagnosis, treatment, and accessibility of genomic medicine. HIPAA doesn't protect your privacy. It opened up your medical records. Your genetic information would be open to the 2.2 million entities who the federal government has given us that number. So it's the 2.2 million entities that can have access because of HIPAA. So take a look at this brochure to know more about what Obamacare actually allows and how intrusive we expect this to become. Because once your genetic information is out there, once your genetic code says what you may or may not be, are you a high-risk patient? If you and your wife come together, is there the potential of a high-risk, high-cost child? we look at the potential in the future of intrusions and coercions, all meant to make you do certain things and have certain choices or otherwise be penalized if you don't. So I just want you to remember that your DNA is your DNA. It's not government property. It's not public property. It's your property, and it's very personal, and it says things about you that maybe even you don't want to know about you. So, so nobody should be able to take it, use it, exploit it, profit from it, analyze it, open it up, and peek in without your informed written consent. And so it's yours, and you need to protect it. Thank you.